Hi, I'm Sarah Doe, and I am a nurse practitioner student in NU 552. Today we're going to be doing a head, ears, eyes, nose, throat, cardiovascular, lung, and skin assessment. And it'll be recorded. If you can please give us permission to record you if you're okay with it and state your age, that would be great.
I am 18 and I have permission.
Okay, sounds good. Thank you. So I have already sanitized my hands here. We've got some sanitizer and I've got my clean gloves on. So if at any time you feel uncomfortable or if you're in distress, let me know and we can terminate the examination prematurely, okay? Okay. So first, by looking at Lourdes, she is alert. She's groomed well. She doesn't appear to be in any kind of acute distress. She appears to be well nourished and her stated age. So the first thing we're going to do is an HEENT exam. We're going to start with her head. So I'm going to examine her head and her scalp, looking for any kind of lesions or masses, any kind of tenderness. You can let me know if you have any discomfort there and anything. And everything appears to be normocephalic, and I don't see any abnormalities. Next thing I'm going to do is to look at her face. It appears to be symmetric, and she has an appropriate expression, and there's no grimacing. And next thing I'm going to do is to look at her eyes. If you can kind of close your eyes gently, I'm going to look at her eyelids. I don't see any kind of abnormality on her eyelids. If you can open your eyes, please, really big if you can. And the sclera of her eyes appears to be white. And if you can look up, please. The conjunctiva in her eyes is pink and nice and clear. So I'm going to look now into your pupils with this light. Okay, and if you can watch my finger as it comes closer to your nose, and then on the other side. Okay, and her pupils are equal, round, react to light, and accommodation. And the next thing I'm going to do is to look for the red reflex in her eyes. So this light is going to go into your eyes, and I'm going to look at it. We're going to see there's a red reflex on her left side, and there is a red reflex on her right side as well. So we've got the next thing I'm going to do is I'm going to look at your extraocular movements. So if you can watch my finger with your eyes without moving your head. Okay, all of her extraocular movements are intact. So the next thing I'm going to do is I'm going to look at her ears. First thing I'm going to start with is the external, and looking to see if there's any kind of abnormalities or lesions, deformities, and it doesn't appear that there are any deformities. Both ears are symmetric. Next thing I'm going to do is to look in her ear canal on both sides, starting with her left ear. I see the landmarks in her ear. She's got a bony prominence. Her tympanic membrane is pearly gray. I did not see any perforations. Now I'm going to the right side, and I'm going to look there. And it looks like the same thing. Everything looks normal and where it should be. So the next thing I'm going to do regarding her ears, I'm going to do a whisper test. So if you can turn this way and repeat after me when you hear what I say. Okay?
7 through 9.
Okay. And now on the right side.
8 through 2.
Okay. So your hearing seems to be pretty good. Next thing I'm going to do is I'm going to look at your nose. First thing I'm going to do is to look at the external appearance, and it appears to be symmetric. I don't see any deformities. And I'm going to use my light and take a look in up your nose. Okay, and it appears that her mucosa is pink and moist, and her septum is midline, and I did not see any kind of deviation there. So the next thing I'm going to do is to look in your mouth with a tongue depressor and check your teeth and check your mucosa and open. Okay, and use my light. Use my pen light. Okay, is there anything that you know of that's loose or painful in your mouth?
No.
Okay. All right, her mucosa seems to be pink and moist. And now if you can open your mouth and say, ah. Okay. It looks like your tonsils are not enlarged, and your uvula is midline and rises symmetrically when you say ah. And can you stick your tongue out for me? And can you go to side? Okay. Her tongue is midline and it doesn't appear to be any lesions on it. She's able to move it side to side. So the next thing I'm going to do is I'm going to feel your parotid and submandibular glands. I'm going to check for any swelling or tenderness. Let me know if you can feel anything that's uncomfortable or if it hurts. Okay. And I'm going to use this cotton tip swab. And if you can close your eyes, please, and tell me how many times you feel me touch. I'm going to start with the left side of your face.
3.
Okay, now I'm going to go to the right side.
3.
Okay, thank you. It appears that her sensation is intact. Now I'm going to be assessing the muscles that you use for mastication or chewing. So I'm going to touch your jaws, and if you can please bite down for me. Okay, your jaw strength feels equal on both sides. Did you notice any tenderness or pain? Okay. The next thing I'm going to do is I'm going to feel your neck. So we're going to check for any kind of JVD. So if you can look that way. I don't see any JVD on that side or on that side. Now for this part, I'm going to check your thyroid. So if you can look up, I'm going to feel over your thyroid gland, and if you can swallow, please. Okay. And I'm going to feel the back of your thyroid. I'm going to feel your thyroid from the back too. So if you could take a drink. Okay. Thank you. I didn't feel any kind of nodules or masses in doing that. So the next thing I'm going to do, if you can turn it back around, I'm going to check your cervical chain lymph nodes. So again, let me know if you feel any kind of tenderness or discomfort. I don't feel any prominent cervical chain lymph nodes. And then now I'm going to check your supraclavicle lymph nodes. Up here again, let me know if you feel anything tender or painful. I don't notice any kind of prominent lymph nodes. So no lymph adenopathy in either set of those lymph nodes. So the next thing I'm going to do is to check your lungs. So if you can turn around, I'm going to first look at your back, and it appears that your spine is midline. And if you can just breathe normally, I'm going to count how many times you're breathing and times it by about 4, so about 15 seconds, okay? Okay, it looks like her respiration rate is about 16, which is within the normal limits, and it appears that there's no extra chest or respiratory effort. It's unlabored and there's no distress. So in looking at her chest, it appears to be symmetric and there don't appear to be any deformities. So the next thing I'm going to do is the palmar palpation of the thorax using the surface of my hands. Again, if you feel any discomfort, please let me know. Okay, there doesn't appear to be any tenderness. Okay, the next thing that we're going to do is, if you can turn around, I'm going to feel the bottom part of your rib cage down here to check for expansion symmetry. If you want to just breathe normal. Okay, it appears to be equal bilaterally, and right now what I'm going to do is to check the tactile fremitus. So if you can please, every time that you feel me move my hands to a new spot, if you can say 99, then that's how we're going to do this one.
99, 99, 99. 99.
Okay, thank you. So this next one is percussion. I'm going to be tapping your back in certain spots, and we'll have you turn around. We'll do the same thing, okay? Okay, posterior appears to be resonant, and if you want to turn around this way, I'm going to do the same thing here. Okay, anterior is also resonant, and then I'm going to check the right middle lobe as well, which appears to also be resonant. So the next thing I'm going to do is auscultation. Okay, first thing is that we're going to listen to your trachea. I'm going to move it this way, and just go ahead and breathe normal. Okay, you've got normal bronchial breath sounds right there, and if you want to turn around this way, I'm going to just listen on the left and right side of your back. Just take a deep breath. If you feel dizzy at any time, just raise your hand and stop for a minute. Okay, it appears to be clear bilaterally, and now I'm going to listen to the right lobe if you want to breathe here, breathe a little deep. Okay, the right middle lobe appears to be clear, and if you want to turn around this way, we're going to listen on this side. If you can take a deep breath, please. Okay, anterior is also clear. So now I'm going to ask you, I'm going to listen for egophony. So if you can, while I listen to you, just if you can hold the tone E. Okay, there doesn't appear to be any egophony. And for cardiothorax, the respiratory assessment with a neck and chest inspection, previously completed with HEENT and lung. Thorax, now we're going to continue with cardiovascular assessment. So we're going to check on some vitals. If I can see both of your wrists, please, I'm going to check your radial pulse. Okay, and they're about 2+ regular. Now we're gonna do your blood pressure, so if you wanna sit down for me, please. Put your blood pressure cuff on your arm. I'm sure we got it over the arterial index marker. Okay, I'll just hold your arm up here. Okay, looks like it was about 118 over 78. So now we're going to check your JDD at a 30-degree angle. So if you can lay down here with your head propped up, and for the purposes of this assessment, we're going to assume this is about a 30-degree angle. Go ahead and put your head up on the pillow just a little bit. Okay, if you can look that way. Okay, and then look over this way. Okay, she's about 2 to 3 centimeters above sternal angle, so it appears that she doesn't have any JVD. Come on up. Okay, so now I'm going to do palpation of the second intercostal space and feel, let's see, your carotids. We're going to feel your carotids first. We're going to do one side at a time. So, okay. Okay, and then I'm also going to feel your midclavicular point PMI. Okay, I am not feeling any thrills. Okay, next thing we're going to do is auscultation. I'm going to listen to your carotids again up here, and I'm going to listen for any bruits. Okay, and then I'm going to listen to the aorta, pulmonic, Erb's point, tricuspid, mitral valve. Okay, and their S1, S2 is normal with no murmurs, rubs, or gallops. So next thing I'm going to do is kind of look at your skin. This was previously inspected during the HEENT and thorax exam, but in looking at her hair, it appears normal in distribution and texture. Can I see your nails, please? Her nails appear to be pink. There's no clubbing or cyanosis. Her skin is warm, dry, and intact. And there don't appear to be any lesions or scars, and the color on it is normal, like there's no mottling or anything. So anyway, that was it. So I appreciate your time and your willingness to be my participant as a volunteer for this assessment.